Good afternoon. It truly is an honor and a privilege to be here. I've been hearing some of the stories of some of the graduates, and they truly are inspiring. As was mentioned, I actually work just across the street at Victoria Hospital as an ICU physician and a trauma doctor. When we were talking a few years ago, Jerry had said to me, we get along really well. It'd be great if you could be my doctor. And I've heard that from other people. Trust me, you never want me as your doctor. Because you have to be half dead. You have to be shot or stabbed or something before you see my face. So if you ever see my face at the hospital, it's not a good thing. I first became interested in medicine when I was 17, and I had to have my own surgery. And I was just blown away by the teamwork and the dedication and the intensity of the healthcare team, not just the doctors and surgeons, but the nurses and the respiratory therapists and the med techs and everybody involved, just working really hard to take care of me, and I found that really inspiring. And medicine has provided just some great experiences for me. Definitely has always kept me on my toes. I was telling Jerry that one of my first summers I was working in Ottawa at the emergency department, and a man came in and he had some kind of pain, and he was requesting opiates. And as I'm sure everybody's heard, even back in the 90s, we had an opiate problem in Ontario. And so I told him that I couldn't give him a prescription for narcotics. And his parting words as he walked out the emerge were, "I will be back, and I'm going to kill you." And so you think, well, that's not going to happen, is it? And sure enough, about an hour and a half later, I was filling out a chart, and I heard this terrible noise, and I turned, and you can't make this up. He was coming at me with a chainsaw. And so you want to see me move fast. Like, I moved fast across the emerge when there's someone right behind you with a chainsaw. And I took a bunch of steps, and then I could hear the chainsaw fading away in the distance. So I stopped, and I looked, and I don't know if you've seen these. It was actually an electric chainsaw, and he'd run out of cord. So he's standing there with this chainsaw in the middle of the emergency department going, "Come here, I'll cut your head off, I'll cut your head off." And then I just stood there kind of with a smile as I see security and then police officers coming around, and the man was arrested. So it's been great. I can't believe I've been doing it for 20 years. And that's a piece of advice. Don't blink, cough, or sneeze, because things go by way faster than you think. I can't believe, like I say, it's been 20 years already. I can tell funny stories all day. I could tell heart-wrenching stories all day. I could tell stories that will make you angry about good things, bad things in our system. But today, I thought that I would share some life lessons that I've learned throughout my career so far. And I think they're applicable to all different forms of work, and hopefully some of this you'll find useful as you're starting out on your careers very soon. One of the first ones is, I love my work. I enjoy getting up. I mean, I don't think anyone gets up and wants to go to work more than other things, but there's nowhere I would rather be. And it's actually, I'll tell you a little bit about it in a minute, but I've taken a fairly roundabout route, and there's been a lot of adjusting and tweaking along the way, and I think that's pretty common these days. I mean, the days of our grandparents where you started a job when you were 18 and stayed at the same company until you were 65 and then retired, that's an extremely unusual story now. And so I think it's very normal for us to have the opportunity to make little adjustments over the years throughout our careers, and I encourage you to take advantage of those. It can be challenging, it can be stressful, because there's so many little doors and decisions that you have to make, but I think ultimately we end up for the better because it allows us to create this job that we enjoy. I feel really sorry for people who are saying, yeah, in 2 years, 4 months, and 3.5 days, I finally get to retire. Hopefully you'll be able to craft a career so that you never feel that way. I would love to work till I'm 75 or 80, just maybe not full time. I think it's important to be passionate about your work as well. I have business friends who tell me that pay doesn't actually motivate people. You think it would, but you give someone a raise, they're happy about their raise for about a week, and then that's their new normal, and they kind of forget about it. And I actually took a business course once in undergrad, and remember hearing, and I'm sure there's people in this room that know a lot more about business than I do, that little things that you can do if you happen to be a leader in your team, little things like knocking off an hour early on Friday afternoon, and this may be politically incorrect, but I was asked to speak by an Irishman. Get a case of beer for the people you work with and just chat about the week and talk about next week. Things like that do a tremendous amount for morale and are a lot more motivating to people than money. It's important, I think, it helps you to feel good about your work, whether you've got customers, patients, colleagues, or your own employees. Treat them well, and remember, it's those little things, not necessarily the status or the recognition or the money, but just how people treat each other on a day-to-day basis at work. Another tip is to be a team player. In the trauma bay, where I spend a lot of time, and you can imagine, people come in shot and stabbed and hit by cars where seconds count, and unfortunately not all our patients survive. It's the teamwork that actually gets me more excited than the adrenaline boost from the actual work. It's the communication when it's so loud in the trauma bay and I have to reach across and grab a colleague's shoulder and squeeze and make sure he looks at me, he or she, and give them the instructions and ask them to repeat back, and off they go, and I have the utmost confidence in them because we've worked so closely together in so many previous cases. It's that teamwork that I find really exciting. And I think you'll agree that very, very few people in any jobs work completely in isolation these days. Almost everyone works in a team. Some people are just kind of naturally gifted team players, and others have to work at it. So whichever one you are, I think it's important to be aware that being a team player is important, and to really try to improve whatever level you're at to improve your teamwork skills. This includes communication too, and we all have stressful home lives, we all have stressful work lives, we all have bad days before we come to work, and I'm sure you've all seen this before, whether it's at school or in other careers. Some people, you can tell they had a bad day before they came to work, whereas other people just show up day after day, they work hard. You might get a sense, if you know them really well, that maybe something went wrong this morning, or something's not great, but they seem to just come to work and be consistent and get the job done. And I think it's really important to think about how others perceive you at work, and to try to compartmentalize some of the negative things that may be going on. Another thing is, as part of a team, is adapting to the situation. Sometimes I've actually done a fair number of job interviews, both being the interviewer as well as the interviewee. And a particularly dumb question I was asked not too long ago is, what is your leadership style? And my response is, well, what do you mean? Like, it depends on the situation, it depends who I'm working with, it depends on so many things. So I think it's important to recognize different situations, and this doesn't matter what type of work you're doing, to be able to step up and be a leader, to be able to step back and be led, or to just be part of a group that's collaborating effectively. Again, one of the most common themes that I'll mention today is to always try to be the hardest working person in the room. People forgive mistakes. We all make mistakes. I have residents and medical students all the time that I supervise, and they make mistakes, and we'll forgive those. But one thing that's hard to forgive is laziness. When you ask someone specifically to do something, and then you circle back and they forgot, or they couldn't be bothered, or they'll get to it. That's tough, and I personally struggle with that. And you won't see too many successful people who have ever been called lazy. So work hard. Try to be the hardest working person around. One of my mentors 20 years ago, when I was a medical student, I'll never forget this, and when you hear good advice, use it, but also feel free to kind of pretend it's yours and pawn it off on others. But this particular surgeon said to me, I'm so tired of you guys being lazy and lying in bed, and when the nurse calls in the middle of the night and wants you to see a patient and you're trying to assess the patient over the phone through the nurse, he said the only question you should ask when you're asked to do work, and this is my line of work, but I'm sure you can apply it to yours, is, okay, can I walk there or should I run? And that's always stayed with me. I think it's really good to have a long-term plan. People used to make fun of me in high school because I kind of could tell them where I'd hope to be 10 years down the road. And I think it's really good to have a plan. It blows me away that some people, you say, well, what's your career plan for September or for next July? And they kind of say, not really sure. You say, well, surely you must have some ideas. No, I haven't thought about it. Have a plan. Have a long-term plan. Have a plan B in case things don't go well for your first plan. But that said, I think it's really important to be flexible and to be able to roll with the punches. I think just about every career is going to throw you some curves, some challenges, but also some opportunities. And you've got to be flexible enough to take those opportunities, roll with them, and take advantage of them and make the most of them. Another thing that I've learned over the years is to have mentors. You don't need to learn everything on your own. You don't need to learn your new jobs, your new careers on your own. There will always be people who are ahead of you that you can ask questions of and learn from. And at the same time, when you're in that situation, remember how it felt to be your first day or your first week on the job and overwhelmed and stressed, and help other people. It used to drive me crazy in university when the second years would all make fun of the first years. Like, guys, 3 months ago, you were the first years. You didn't like it. So remember that and be a good mentor to others. A favorite quote that I heard from Dr. Brian Taylor, when one of the surgeons at University Hospital, now retired, on my graduation was, and this is a beauty, was he said, good judgment comes from experience, and experience comes from bad judgment. So we all make mistakes. It's important to learn from them. Even better, though, than learning from your own mistakes is to learn from the mistakes of others so that you don't repeat their mistakes. This one's not always possible, but boy, has it ever helped me. Try to work with people you like. Now that sounds really easy, sounds really obvious, but as much as possible, if you have any control over the team that you're working over, try to like the people you work with and try to work with people you like. It'll make things a lot more enjoyable for everybody. And there's idiots in the world. We're all going to be stuck working with idiots. But rather than focusing on them, embrace the people that you like working with and tolerate kind of the challenging people. Another piece is to be humble. Nobody knows everything. I have a lot of teachers in my family, particularly high school teachers. And it's funny, if you think back, in high school, you ask the teacher a question, and you ask them another question, and if they don't know the answer, they're almost embarrassed to admit they don't know the answer, and you think less of your teacher for not knowing the answer, but nobody knows everything. And in fact, I think it's the people I respect the most that are able to say, I don't know the answer to that, but I'll find out. The more you know, the smarter you are, the more comfortable you become saying, I don't know. And there's so much to learn. I think it's important to be a lifelong learner as well, and medicine has been great for me for that, but I think many areas are the same, where there's an opportunity to always be building on knowledge, taking new courses, taking on new challenges, and getting better. For those in leadership positions, and that will be many of you, if not at the beginning, later on in your careers, it's important to accept responsibility for everything and everybody under you. I have 50 people that I'm supervising right now across the street. If anyone makes a mistake, and the consequences of mistakes in my line of work are serious, I have to own it. Never deflect the blame onto others. Own it. So take credit for give credit to others for successes, but accept responsibility for failures. And the people that you work with will respect you, and they'll work harder for you, and they'll enjoy their work, and everyone will benefit from that. I won't pick on Jerry, but my dean, when I was an undergrad, was also the rugby coach, and he was this guy who was about 5'3", and every one of his players would have died for him. They would break their ribs for him, and it was because he was so inspiring as a leader, and because he gave so much credit to the team around him, that he lifted them up and made them work that much harder. Control what you can, and accept that there's many things beyond your control, and try really hard not to worry about those. And like I said, embrace the great people and the great things. I was going to say, partway through my residency, one of my mentors pulled me aside, and I was having a bit of a struggle. The novelty of what I was doing had worn off, but the finish line was still pretty far away. And he said, do you ever celebrate victories? Do you ever pat yourself on the back when you accomplish something? Or is it always like you just achieved one thing and now you're looking to the next goal? And I think it's important to take a little bit of time and try to celebrate even the smallest accomplishments, the smallest victories. We had a girl actually came to our ICU on Friday. She just graduated from Western, and she was our patient 2 years ago. And none of us thought she was going to survive. If she did survive, we all thought she would be terribly, terribly brain damaged, and she just finished an organic chemistry at Western University. She's funny, smiling, happy, outgoing, and that, just seeing her, will probably keep most of me and my team going for at least 6 months. And circling back, work hard. I've said it before, say it again. Work hard. I think it was Oscar Wilde who said, I'm a firm believer in good luck, and the harder I work, the more of it I seem to have. So in finishing, I'd like to congratulate all the graduates and their families as well. A huge achievement. I wish you all the very best for your futures, and good luck.